I would like to talk a little bit more about calcium burden and the distribution in patients and where is best to look for that in your report. Obviously, we can come here and see in our calcification view, we do have calcium burden on the leaflets, as well as a little bit of a chunk in the STJ. This patient does have coronary disease, which is always good to keep in mind for future intervention, especially while doing your valve selection, which we'll talk about in another episode. But not only looking at this, viewing calcifications, also coming down to the hockey puck is really good to see where it's distributed. So for this patient, it's really on the outer of those leaflets, and it's perfect case of severe aortic stenosis. And this patient will really benefit from a TAVI valve. But you can also see the depth on the side as well. This is upside down because we've kept it in that bird's eye view of the same orientation as the annulus image on that perpendicular plane. But if you flip it back upside down, you can see there on the STJ and on your coronaries as well. However, if you do want to do the calcium quantification, the best way to do that is with a non-contrast CT to have as comparison. But I highly suggest you don't ask your radiology centers for non-contrast CT. Otherwise, that's all you're going to get and you won't get any contrast ones. So it'll be a bit of a headache. However, if you are lucky enough to have it, you can use this calcium quantification tool. Just clicking on the eye there, it will turn it on. And this is what it is reported through 3Mensio. So the validity of it is not exact and it does not replace the calcium score test. That is definitely most recommended when referring a patient for the CT. However, we can see the calcium burden for this patient in the annular section and on the leaflets. You can again score them separately, but it's up to you if you're going to treat the patient on a number or on their symptoms and if they meet criteria for you. So it's a personal preference. But I know some people out there really do like that visualization, and that's really all it is. It's not actually a screening tool in terms of that. Just making sure that you're also aware that you can negate this score by how much you include or exclude. So you can increase or decrease it by adjusting on those blue lines. So you have to use it with caution. And if you're doing it yourself, that's okay. But if you're not getting the reports of other people, it's best to just take it as face value because obviously it can be manipulated. And seeing that little bit there is taken out from the STJ. It's just a great guide. Also, you can get interference from patients that have prosthesis. So anything like stents or pacemakers, anything like that can also affect it as well. So you have to keep that in mind. Another tool that I do really like to use is turning off this calcium quantification. I tend not to use that too much, but I do like coming out to the double oblique image and having a look at your LV and if the patient does have any mitral annular calcifications. So this is a really nice image that it's good to show, and you can see the contraction patterns of the left ventricle if it's in the systolic or diastolic phasing and if it's dilated or not. So again, you can spin it around here and see the other side. Basically, it's really good to be able to see if the calcification lies close, if there's going to be any interaction with your valve or balloon, or any risk of a pacemaker with calcification sitting on that membranous septum. Again, I hope this has been really helpful. If you do have any questions or comments, please feel free to add them below. Otherwise, I'll catch you in the next episode.